Mayor Alowis.
Yes.
Motion carries 5-0.
Thank you. This brings us to item number 7, COVID-19, reopening of the economy, discussion on roles and responsibilities requested by Council Members Boyer and Thompson. I invite City Manager Adam Raymond to report.
Good evening, everyone. Apologize for the sun coming in. It's setting right through the window, and I don't have any blinds in my office here, so apologies for the visual there. So this item tonight, just a reminder, is being broadcast on Facebook Live as well. As we've gotten or received more and more questions of late about reopening of the economy, we thought it was a great time, and I appreciate the request by Council Members Boyer and Thompson to have this conversation at the council to talk a little bit about from a federal level, a state level, a county, and a local level, sort of the rules and regulations in place, and have a brief reminder for everyone of just how we approach this moment. So I apologize in advance for some of the length of the presentation. We will get through it as quickly as possible and turn it open. But just a quick reminder, late 2019, COVID's discovered in the Wuhan City in China. By late January of the current year, WHO declares COVID-19 a public health emergency of international concern. Next slide, please. In about the same time in the United States, Human Services declares it a public health emergency in the United States, and by February of 2020, the CDC says this will be a community spread disease. This slide here is very important. There are 3 specific actions here that largely shape the way in which we must follow our business regulations and gatherings. On March 4th, both the state of California and the county of Los Angeles declared both a state of emergency and a local health emergency. On March 12th, Newsom issues an executive order N2520. This executive order provides local health agencies, and for us, that's the County of Los Angeles Department of Public Health, the authority to further regulations to limit specific essential businesses and types of gatherings. March 13th, the United States declares a national state of emergency for COVID-19. On March 17th, we declared a local emergency as it relates to COVID-19. That decision was ratified by the City Council on March 24th. Our current safer at home orders are the stay-at-home orders from the state. It's important to note that the state does not have a proposed end date. At the county, the proposed safer at home is currently in place through May 15th. That was exercised on April 10th of 2020. So sort of hopping with that as background as we hop into it, we get to have a conversation on the 10th Amendment and federalism this evening on who gets to make the decision to open the economy and when. I think it's important to note that life as we know it has been fundamentally changed. There are fewer airplanes flying over the United States during the age of commercial aviation other than the week after 9/11. We've had more than 26 million unemployment claims filed in the United States. There are so many unemployment claims that have been filed that states are hiring retirees in those areas to help process them quickly. It's not just an issue in California and New York, but many states as well. There's lots of confusion out there about the statistics. How many cases are there? As of this morning, there was 3.1 million cases worldwide. That's not concurrently. That is overall since this has happened, and those are confirmed cases, not potential cases that are out there. The data that we get on a daily update from LA County takes into consideration, again, the cases, and we have studies that are out there that now say potentially the amount of the infection rate is quite a bit higher. We get a lot of questions on the numbers and the rules that are in place. Why can one county do one thing? When is the city going to open up? And so it's very understandable that there's a lot of confusion that's out There's also a lot of fear. People are fearful that their loved ones themselves, their children, will get sick. In LA County announced this week that COVID-19 is the leading cause of death in Los Angeles County. On top of all this are some incredibly profound economic impacts. We talked a little bit about the unemployment claims. In the state of California, that's more than 3 million claims. In Los Angeles County alone, we're approaching 2 million unemployment claims, which is a staggering amount for the county. So this evening, we're going to talk a little bit about the timeline that we just did and how we got here. We'll talk about the city of Glendora's options. But first, it's important to take a step back and talk from the feds on down as to these terms that you've likely heard, and hopefully we can provide some clarity. So many of you have heard the Opening Up America again. This was released 2 weeks ago. On the federalism conversation, these states have the right to open the economies as they see fit. To help these states open up their economies, Opening Up America again was a joint effort with the president or the White House and the CDC, and this provides guidance. I will tell you that as we go through this and we talk about the feds, the state, and the county, you will see more similarities than differences. I think there is some clarity that needs to come in, but I think most of the major organizations are all on the same page moving forward. Next slide, please. Before we can even begin through the federal process of Opening Up America again, there's a 14-day period where the total estimated cases, like symptoms, and actual hospital patients are declining. So before we can move through the 3 phases in Opening Up America as a guideline, first we need a 2-week period where the shelter-in-place orders have had significant impacts on the actual cases. Next slide, please. So in phase 1 of the proposed guidelines for Opening Up America, you have to evidence as you move from phase to phase that there is not a regrowth of the infection, that there are not some large issues. And throughout all phases again, things your mom probably told all of you: wash your hands, don't touch your face, disinfect frequently. And in this case, also, the feds are strongly considering the use of face coverings and also encouraging people who feel sick not to return to work. Next slide, please. So in phase 1, there is this perceived notion that social distancing would still be less than 10 people, that vulnerable individuals, those over the age of 65, those with that have health conditions, stay home, that employers will still work, that employers should still encourage employees to work remotely. Schools, daycare centers, camps, large assortments of students and young children still remain closed, and visits to senior homes and hospitals are prohibited for everyone. Next slide, please. Additional in phase 1, large venues, dine-in restaurants, movie theaters, sports venues can reopen, but only under strict social distancing guidelines, which potentially means no live audience in terms of a sporting event. There is a thought that gyms can reopen if they adhere again to the social distancing guidelines and very specific sanitation controls or protocols as issued by the CDC. In this case, also, they're encouraging bars to remain closed, but elective surgeries can resume as long as they are outpatient in nature. Next slide. In phase 2, they're still recommending that vulnerable individuals stay home, that there's no public gatherings of more than 50 individuals. Employers are still to encourage the employees to stay home. Schools, daycare centers can reopen, again, with strict social distancing guidelines, and bars can open with reduced standing room occupancy. And in phase 3, vulnerable individuals no longer need to stay home, but they encourage those vulnerable individuals to continue to practice the social distancing. Employers can allow their employees to return to their physical work conditions. Visit to senior care facilities and hospitals can resume, and large venue, movie theaters, sports venues, etc., can open under limited physical protocols. I think it's important here if we can go back to the last slide really quick, there are no dates here. And one of the things you will find common among every level is the dates. There are no specified dates here. This predicates that every state is different, that the challenges in New York, California, Florida, Texas are different than those potentially in Colorado, Wyoming, North Dakota, South Dakota. Every one of those cities has a different population. While larger cities may have higher risk of infection rates, states are very different. And so this methodology used as a guideline for states allows those timelines to play out on every state individually. Next slide, please. So to recap, that's the guideline from the federal government. As you will note, the city must follow two very specific bodies. One is the state of California and one is the county of Los Angeles. Through the state of California, there are three areas in which we'd like to discuss: the Western States Pact, the California Roadmap to modify the stay-at-home order. This afternoon, California Resilience Roadmap stages were released. And finally, we'll talk a little bit about Task Force on Business and Jobs Recovery. Next slide. So 2 weeks ago, and then yesterday, the Western States Pact was both formed and then added 2 states. California, Nevada, Colorado, Oregon, and Washington have agreed to this Western States Pact. That group compromises 1/5 of the population in the United States. They agreed to sharing and benchmarks for recovery, to a unified system of tracking and isolating those with coronavirus symptoms. Increased hospital capacity remains in place, and personal protective equipment or protective gear is readily available. This allows the continued protection of vulnerable populations, and especially those in nursing homes. Next slide, please. So with that as background, that the Western United States is in agreement with how it should open, 2 weeks ago, Newsom issued a California roadmap to modify the stay-at-home order. There are 6 areas here in which the state will evaluate the current COVID infection or pandemic before they are willing to modify the stay-at-home order. And that's the ability to monitor and protect the communities through testing. It should be noted that the required testing is somewhere in the 60 to 80,000 a day range. Last Friday, we were at 18,000 tests a day in the state of California. The state also looks at the ability to prevent an infection from people who are at risk. This will be a common theme throughout. And the ability of health systems to handle the surge and still remain operational for the normal day-to-day activities as a hospital. Next slide, please. Number 4 is the ability to develop therapeutics to meet the demand, and that is the cure. That is a term used for a wide variety of treatments for COVID. The ability to have social distancing for non-essential businesses and schools and childcare facilities, and also the ability to re-implement the safer at home orders in a very quick basis if needed on a localized level. So this afternoon, when we talk about rules change frequently in the confusion, well, a lot of this PowerPoint presentation was prepared earlier, and then today the world changed a little bit. And so today, Newsom released the California Resilience Roadmap stages. So taking those 6 criteria into account, we now have stages like President Trump and the CDC recommended. However, instead of having 3 stages, there are 4 stages in California at a high level. If we go to the next slide, please. The first stage is where we're at now. Oh, sorry. Before we get to move from stage to stage, like at a federal level recommends, there are some milestones that must be continually met in place before we can move to the next stage. Here, and Newsom notes specifically today that in the coming weeks, when modifications are made, you won't see dates here either. You won't say May 15th we're moving forward or June 1st we're moving forward. You hear a lot of the coming weeks. So the items that are there before highlight many of the areas previously spoken about: adequate personal protection, We have available demand. We're able to track people who are infected. Hospitalization and ICU admissions remain stable, so hospitals can continue business as normal. All of these things must be tracked at very specific levels before we can move from stage to stage. But with that, we'll turn it over to stage one. And Kathleen, if you can please move forward. So stage one is currently where we're at, and the state intends to continue to build out its testing capacity. The contact tracing, meaning can we track where the infections are and hotspots. Additionally, they want to make sure essential business workforce remains as safe as possible. And then, as we're doing now, prepare a sector-by-sector safety guidelines for an expanded workforce, meaning those businesses deemed non-essential that come back. Next slide. So the first stage that we'll enter into from where we are now is stage two, and that's to open up lower risk workplaces. Gradually, it'll be a gradual endeavor, including curbside pickup like retail, areas such as manufacturing, office-related jobs when remote work isn't possible, and opening up more public spaces, perhaps beaches, trails, and open spaces. Next slide. Very specifically, they mentioned that the local health officers will have a lot of flexibility in implementing stage two. And so for us, that means Los Angeles County Department of Public Health. And also this requires the surveillance of the disease transmission and potential modifications to reapply safer at home provisions if the issue gets worse. Stage three looks at higher risk workplaces, personal care. So all of those people asking about hair and nail salons and gyms, this is your stage in California. Again, no date, whether that's a month from now or 2 months. It's all predicated on the fact that we can continue to increase the testing capacity and put protocols in place to ensure people can social distance and remain safe. This also includes entertainment venues, movie theaters, and please note here, specifically from the state, it's sports without live audiences. So even here, while at home we'll get to watch potentially the Lakers and the Clippers or the Rams and the Chargers, you won't be able to attend those functions should they be open. And this is the first mention of in-person religious services, churches and weddings, for example, funerals as well. Stage four is the end of the stay-at-home order. So much like the federal guidelines for Open Up America, again, this is where there's a wide range of activities allowed. And again, we see the word therapeutics, meaning the cure and other places are in hand for COVID-19 before the eventual total reopening. Again, just like to add that there are no dates here. Next slide, please. Newsom has also implemented a task force on business and jobs recovery. There are dozens of business leaders that have their names on here. Their goal is to assist economic and social sectors to chart a path forward from the COVID pandemic. The co-chairs here are Ann O'Leary. She's the chief of staff for Newsom, plus Tom Steyer is names you may remember from running for president. He's listed here as a philanthropist, environmentalist, and businessman. Other members include Janet Yellen, Bob Iger, and Ada Alvarez, all names you may remember from high-ranking federal positions to Disney and to the Small Business Administration. Next slide, please. As we jump to the county and sort of as we go down the chain, the state sets these overall goals, which all entities, counties, and cities must adhere to. The county then has the ability to add additional restrictions. So the restrictions we're currently under, again, relate to Executive Order 2520, which provides local health agencies with the authority to limit gatherings and types of businesses for agencies within their jurisdictional boundaries. Los Angeles County is unique and extra confusing because in Los Angeles County, not only does the county have a health department, so does the city of Los Angeles, the city of Long Beach, and the city of Pasadena. All of those agencies together have created the Safer at Home program, which is currently implemented throughout Los Angeles County. Next slide, please. There have been many health orders relating to the stay-at-home initiative, which are currently in place till May 15th. We'll go over some of the highlights here for our current restrictions. Modified operation of essential businesses. We still have to implement social distancing protocols. For example, employers are encouraged to have their employees work from home if possible. And we just talked about the mandatory implementation of social distancing programs. Next slide, please. We've also eliminated access to beaches, trails, and open space and playgrounds in Los Angeles County. This is different from other counties, as you've probably seen in the news last weekend. The state does close beaches, but Ventura County, for example, cities open beaches, and some cities in Orange County open their beaches, but not all cities in Orange County, which again goes to the furtherance of the confusion that's out there. But for those of us who live and work in Los Angeles County, these are the rules in place here. They've also eliminated all gatherings outside of the home, as well as closed access to certain trails. So last week, the Board of Supervisors on the reopening of the economy had some prerequisites. These will sound similar to the state, which is adequate healthcare capacity, including staffing and testing, protections for high-risk populations, the capacity to quickly re-implement safer at home or stay-at-home endeavors, or initiatives, and the ability to maintain physical distancing to help control the infection regardless of where we're at in the recovery. Next slide, please. Today, Los Angeles County added some timelines to these. So the state had an announcement, and Los Angeles County Board of Supervisors on their meeting had 2 items. The safely reopening Los Angeles County was board item 19. And Los Angeles County Roadmap to Economic Recovery was item 20. Both of these were approved by a 5-0 vote. Quickly, as it relates to item 19, next slide, please. The County Board of Supervisors directed staff to report back to the board in 7 days with the details on measures and prerequisites for relaxing the safer at home order. So if we recall, the state initiated that some non-essential businesses may open in phase 2. The board is going to ask for staff to come back within 7 days to lay out some of the particulars for opening up some of those non-essential businesses in a week. Does that mean they'll open in a week? Not necessarily, no, but we'll have some additional guidance for what that looks like in the economy. Additionally, the Board of Supervisors directed staff to come back in 14 days or 2 weeks with recommendations similar to those being implemented by the state's group on how we revitalize the economy. This is to leverage private and public partnerships in Los Angeles County. Next slide, please. City of Glendora. So we've just talked a lot about what we must follow, and so the question, just to repeat it one more time, when will the city lift the Safer at Home Health Order, County of Los Angeles, and Stay at Home Order from the state of California? The answer is when they tell us we can. The city is subject to the direction of the state of California and must follow the executive orders issued by Newsom. The city is also subject to the direction of LA County and must follow health orders as well as other executive orders issued by the Board of Supervisors. Next slide. So what can the city do? The city always has the ability to place tighter restrictions on essential businesses and social distancing. To date, we've avoided doing that to help create additional confusion. Plus, with all the orders in place, we are following the county's lead, as the city does not have a public health department. The city can also advocate for a loosening of the restrictions that are currently in place. While we can't mandate them, we can advocate for that, or a quicker loosening or opening up of the economy. We can inform the community of the rules in place, which we've done so many times. We can inform the community on best practices to stay safe and programs available to them, which we have done. And we can also work to implement programs to assist those in need, which we have done as well. Next slide, please. So from the fiscal impact standpoint, we talked a lot about earlier about sort of the unemployment rates, the number of unemployment claims, and when you choke the economy like we have through the Safer at Home orders and shutdowns, it creates quite a challenge for a period of time. The severity of the challenge at hand, how quickly we'll turn around, is anyone's best guess. If someone tells you they have a definite answer, that's conjecture at this point. But to give you an idea of where we currently sit at, so to date, from a federal level, from the relief packages have been in the trillions of dollars. They've included funding to businesses and stimulus checks to individuals. The CARES Act that we've heard a lot about, of that total amount, the city received approximately $170,000 in additional CDBG funding. No direct allocations yet. As you may have heard, many of the programs, including the SBA loans, have not been widely received, but there was an additional round approved last Friday. Next slide, please. From a more local level, the California League of Cities has indicated that the COVID-19 pandemic will impact general funds of cities by approximately $7 billion over the next 2 fiscal years. This doesn't include counties or the state. These are only cities within the state of California. These assumptions contemplate a general opening of the economy by June 1st. Any delays in that by months will increase that number by billions of dollars over the next 2 years. Currently, to date, based on the survey of all California cities, 90% of cities are looking to reduce personnel or reduce services to the public. About 72% of those agencies are looking to do both. As it relates to the city of Glendora, we currently have looked at our general fund revenue impacts. We estimate that the impacts of COVID-19 are approximately $1.5 to $2 million in our current fiscal year, $2 to $3 million next year. A lot of this is associated with decrease in sales and other types of rental and facilities. Since we don't know social gathering limits, it's hard for us to book classes in our recreation, have rentals on the library for the library and related rooms there, as well as hold other events throughout the city. We've also begun to see some of the slowdown in development over the last 2 weeks, but it's hard yet to tell if that's going to be a significant change or not. Because of the timing and all of this, further updates will be provided to the City Council in late May to mid-June when a clearer picture of the economic landscape exists. I will, for a moment, if we can go back. At this time, we are not one of those cities looking at significant reductions in both services to the community and personnel. As we move forward with the budgetary process for next year, we are an incredibly fortunate city where Measure E has been passed by the voters. And a goal here, as you'll know, if we can maintain services, that's a huge win locally. That's providing and ensuring our staff is being paid so we're not adding to the economic hardship that's already in the state of California. And we're continuing to provide those services to the residents while trying to do whatever we can to help out the businesses and the residents as well. And so that is our task moving forward. That is what we will continue to do. Inevitably, none of this takes into account potential impacts of the stock market on CalPERS and other related expenditure trends that may occur. But because of the city's financial position, our AAA bond rating and our general fund, the pension obligation bond that was issued, and Measure E, Glendora is in a pretty great financial position to address these concerns. We will not be forced into making rapid changes. We will take our time to make clear and concise recommendations on how to move forward through this. Next slide, please. So a lot of information that was shared tonight. Again, the city's website is a wealth of information, LA County Public Health, CDC as well. We included 2 links from the plans produced by both the president and Newsom. I think it's important to note that information is changing rapidly. We've done our best absolutely to try to recount some of the current restrictions in place and guidelines with fully understanding that it is confusing. Next slide, please. And we requested the City Council receive and discuss, ask a lot of questions if you have so, and we'll continue to try to take a look at questions as they come in potentially as well from the public on Facebook Live to try to answer some of those questions if there are any. And with that, I'll turn it over to you, Mayor.
Thank you, Adam. And with that, I'm going to bring it back to council. I'm going to start with Gary Boyer and Mendel Thompson since they were the makers of this request. Gary?
Hey, thanks, Michael. You know, it's Mendel and I discussed, and we thought this was an important conversation to have, and I'll just share my 2 bits. And things did change a little bit with the governor's announcement today, but overall, I believe that California and Los Angeles County has actually done a pretty good job in dealing with the COVID-19 crisis so far. The fact that the number of cases and deaths have not come close to the modeling that was originally put out there is a testament to the fact that Californians, and especially Glendora residents, have done a pretty good job in taking all the precautions that have been placed on everybody. Adam already mentioned it's important to understand that Glendora does not have the authority to lift these restrictions. We all hear about other cities that are lifting restrictions and loosening things, and it's because there's many cities placed additional restrictions in place over and above what the federal, state, county government put in place already. Glendora chose not to add to the confusion by placing any local restrictions on top of the myriad of restrictions that are already in place. Personally, I believe we probably overreacted to this crisis, but I'm not sure. I'm not a scientist. I'm not a doctor. And I'll tell you, if the Dodgers started playing ball next week, I'm not taking my grandkids to a Dodger game. So I'm going to follow the advice of the experts. You know, the unfortunate thing is not all the experts agree on what we should be doing. That being said, we've been doing this for 38 days at this point, and it's time to start planning to getting our lives back to normal again. Los Angeles County extended their safer at home restrictions through May 15th. State of California, their restrictions are in place indefinitely, and it's important for people to know that indefinitely means no definite time. It doesn't mean forever. Even though May 15th is another 17 days from now, at least we have some guidelines as to when Los Angeles County is going to start easing restrictions into what they're looking for. The governor started to give us some insight into what to expect today, but we need to start hearing from the county and the state some positive, precise, and accurate information as to what the reopening of California is going to look like. LA County is actually, they've set up 4 goals. Number 1, we need the capacity to care for those that are sick. And I think we've met that goal. We're finding that the temporary hospitals are being closed. The Mercy hospital ship has left Long Beach and is heading back to San Diego. So I believe we've met that goal. The second goal is to protect those who are vulnerable. Well, I think we've proven that we have the ability for people to isolate anyone who feels vulnerable and they feel the need to take that extra care. Number 3, we need the capacity to test, isolate, and quarantine. I don't think there's any question that we know how to isolate and quarantine. I've done more puzzles than I've done in my entire life the last 3 or 4 weeks. And I'm pretty sure that the testing ability is getting close to being prevalent. The city of Carson announced yesterday that they are going to start offering testing to every one of their residents, regardless as to whether or not they have any symptoms. And then their 4th guideline is we need to engage in physical distancing. And there's no question we have that down to a science. We are very careful when we're around each other. Now, even though Governor Newsom finally gave us some hope with today's announcement, we need to encourage the county and state to understand that we have followed the rules. Things are better, and it's time to hear a plan about reopening California. So what I'm hoping that we do tonight is that we can take a position to write letters to our representatives, letting them know that it's time to see a plan to reopen. But more importantly, under no circumstances will we support any additional restrictions or extensions to their orders. That's pretty much what I have to add. And Adam, it was a great report, but I think it's time for us to make sure we keep up the pressure. And hopefully this won't just be the city of Glendora. We'll have 88 cities in Los Angeles County and 400 or 500 cities in the state of California taking similar measures. With that, I'll turn it back to you, Michael.
Thank you, Gary. Mendel?
Michael, thank you. And Gary, I echo every single word and idea that you have said. I know that, as you indicated, that you and I have talked about this. And I have read the studies from Stanford, from USC, a number of people that everybody would know, but I'm going to defray drilling down and going into all of the numbers. I just want to say just a few things. First of all, I agree that we as a city have done an excellent job in meeting and doing and living out the orders that have been given to us. Second of all, as a family that I have, and there's 11 of us, we have my father-in-law is 85 years old, and on down to a grandchild who's 5. And there's a few of us have some, underlying health things that we have to worry about. So I understand that from age, from health, protection, be aware, and I get that. And I think we all share a deep sense of loss for the 57 some thousand people that America has, lost. But with that said, I agree with Gary that there needs to be a balance. There needs to be a middle ground. There needs to be a voice for the business people who, as I look in many of their eyes, they are desperate for help. The virus has maybe not made them sick, but emotionally, financially, just in all kinds of different ways, they are deeply sick. They are losing hope, wounded. And at some point in time, we need to be an agent of change and help express in no uncertain terms to the county and to the state that we need to pivot and make sure that in a safe way and in the care of those that are older and have some underlying health things, that we can still open, because as our businesses die, and which some of them have, and some of them are on the very last gasp of life, we are going to be in a desperate state. And so it's my hope that we together as the 5 of us, and along with city staff, as Gary had said, to write a letter to both the county and state and urge them, capital URGE, to act sooner than later. I do appreciate what our governor said today, and I watched that, and my hope went up, a little bit. But we need to be a voice of that change. And I would, in my last point here, and I would suspect that most of the constituents that we serve would support a planned, a measured, a well thought out rollout to re-engage, to reinvent, to reinvigorate the restaurants, the businesses, the stores, everything that has been shut down. And I'm confident that a majority of our folks would really support that. So it is my hope, as Gary said, that at the end of the day, as all of us talk about this, that we can have a balance, a tolerance for, yes, there is still risk. There's still life being lost, but there's a lot of other things that are being lost too. And it's my hope that cities can start to speak up. We just heard that, Adam said that the county needs some input in 7 days and in 14 days. Well, this is our chance to speak up and exercise the elected positions which we all have. So with that, I will yield back to Michael. Thank you.
Thank you, Mayor. David?
Thank you, Mr. Mayor. I applaud you, Adam, for the continued diligence and report, extremely thorough, and how you catch all those BBs from that shotgun shell that are constantly changing. It's amazing. But to you and your staff, thank you. Doggone it, it's not good news. It's very discouraging that it's not a light switch solution, which I think we would all hoped for at this point in time. We're not going to see that. And the fact that the news is realistic but doesn't have the dates that we're hoping for to be able to say tomorrow's the day, that's discouraging. And I echo Gary and Mendel on their thoughts of let's keep that news and that information coming and tell our citizens and our members of our community. But in the same vote, we need to be aggressive to get the economy going, because I'm very concerned for the choked economy and the fact that our businesses are struggling. So anything we can do to get that turned on would be fabulous. And I hope that we users of those businesses will respect the guidelines that we're given when we get to go back out and re-engage, and we don't get it turned off and taken away from us again. Please, let's move forward and make those voices and be heard, as Mendel suggests, with now's the time to stand up and wave our hand. Thank you.
Thank you, David. Karen?
Thank you. I just want to applaud Adam and all of the city staff. Everyone's had to be very flexible and trying to do their job in a different way, while also responding to the ever-changing information and guidelines. So thank you, Adam, and thank you to all the city staff and department heads for your continuous flexibility and great response. I think that you have continued to lead and care for the city. And, I am not a doctor or scientist, and I don't play one on TV either. So waiting to see what further guidelines come down. But I think what both the county and the state said today reflects that they're trying to look at practical ways to move us forward and also address the needs that are out there, both from the health standpoint and from the economic standpoint. So I see it as a team effort, that as we work as a team with the county and the state, that we can do more together. So again, thank you to you and all the staff for your stellar work throughout this pandemic.
Thank you, Karen. For all those that are watching that don't have the privilege of getting Adam's daily briefing, the briefing that everyone just had today from Adam is what we get every night. It's amazing, to David's point, like catching BBs. How does he catch all this and get the accurate information all the time? And that's a tall task, as well as staff working with Adam and trying to implement this stuff and still keeping the business of the city moving forward. I know that we're all have information overload. We're all listening to radios, TVs, trying to get all the information, questioning the data, and it's extremely frustrating. But by the same token, we're also an independent city. We need to go out and we need to tell our other officials higher up that, listen, we need some clear direction. It'd be very preferable to have clear delineations of what to expect moving forward. I know they're working on that. They've already put out their 3 steps, but I think we need to move along a little further. And from what we've been hearing this week, it looks like the numbers are dropping. And I think we have to wait another 7 or 6 days or so, that we found out on yesterday. So we're heading in the right direction. But I also agree with the stance that both Mendel and Gary are taking, and I would be in agreement with what they would like to do. Is there any other further questions from the council?
No.
Mayor Alois, we have received a couple of questions either via email or Facebook Live that I would like to read out and try and see if we could get responses to.
Please go ahead.
So what about the businesses that are doing all the proper steps? Why can't they open?
Adam?
So in and of itself, part of the issue is we don't have the okay from LA County. And so I think it's just important to remember that on March 12th, Newsom provides, through the state of the emergency, through a state of emergency, that the county public health officials are the ones who get to set a lot of those guidelines. Business and how many people can gather. So we absolutely applaud those individuals who have taken those steps to ensure that people will be safe and protected. So we simply can't turn on that light switch. We can definitely advocate that those businesses that have done their due diligence, that are prepared for the reopening, are able to do so as quickly as possible. And I think in that vein that you heard from Councilmember Boyer and Thompson, specifically, that be advocating for that specific date, so businesses like those that are working behind the scenes to comply with social distancing and sanitation and protecting their employees are able to open quickly.
Thank you, Adam.
And we have another question is there any way to open the South Hills Wilderness Park or any of the trails prior to May 16th? I am unable to make any comment. Oh, and that's the question.
Okay. So one of the other county health orders specifically talks about trails and open spaces. So one of the public health orders closes those specifically from Los Angeles County. So unfortunately, we can't open up those trails and open spaces, which I know many members of the council and myself utilize on a regular basis until the county tells us we have the ability to do so.
Thank you, Adam. Any further questions, Kathleen?
I guess there is a question about the South Hills and the trails and the camps that are currently up there. And then the other one is, what are the medical reasons for closing open air trails? And then they express, I'm not in favor of mandatory testing of residents. And that's it.
Adam, you want to take a shot?
Sure, I will give it my best. So currently, staff is aware of some of the homeless encampments that are in and around the South Hills area and open space. So that area is closed, and we've been working with those individuals to try to find them room and board. In fact, LASA Union Station have been out to those areas trying to find the best case scenario for housing options for all those individuals and services as they need them. Our goal then would be, like other times when all of those criteria have been met, services have been offered, and we can find even interim housing or temporary housing for those individuals, we'll go ahead and go through the cleanup process through Ocean Blue, Athens, our public works, and our police crew. So we'll continue to go down that process as well. It's starting to get warm. We want to avoid potential impacts from health and safety of the homeless individuals there, plus also potential fire issues. So with many of the funding sources available at the county level and state level, we're finding rooms for homeless individuals, especially those over age of 65. Additionally, at the last meeting, council approved the appropriation of $150,000 for rooms we've acquired locally through our own hotels to help better the economy and to help with the spread of COVID amongst the homeless population. And funding this ourselves and seeking reimbursement through FEMA directly, we're able to provide light services, food, and shelter for Glendora homeless, not those in the surrounding area, as it relates to things that are out of our control. So as it relates to homeless in the South Hills and homeless anywhere in the city of Glendora, we're working as quickly as we can with the resources available to house those individuals. And again, for South Hills, we don't have the ability to open that pursuant to a health order by the county.
Thank you, Adam. Kathleen?
That is it. I have no other comments.
The mayor, if I can quickly, it sounded like there was the request. I know the recommendation is to receive and discuss. Did I hear that there was a recommendation from the council to send 2 letters of advocacy, one to the county and one to the state? For the county, that would be pursuant to the board action this afternoon that input is received from the cities that we're advocating for a timeline. I believe Councilman Boyer mentioned a non-extension and a non-furthering of reductions, but a measured and quick process leading us through a reopening of the economy and all of sort of the other areas that were there. So to be precise, that that sounded like there was a recommendation to issue a letter to both the state and to the county advocating for a reopening for non-essential businesses, so far as we take into consideration social distancing protocols and other related measures, and continue to move forward with something no later than May 15th.
Does Gary or Mendel, do you want to move his Adam's suggestion?
Mr. Mayor, I would certainly move that letters be sent to the county. Now, obviously, the county does have a date, so the letter to the state would have to embrace that date, and I hope that the council would. I'd also like to add a prefacing statement to thank them for the aggressive work that they have done that has certainly helped save a lot of lives, and I don't want to overlook that. And I hope that the council would approve that. But Adam, yes, and Gary can certainly add his thoughts, but I would like to at least offer the thought that no further rules or mandates, restrictions be applied, but that we move ahead aggressively, progressively in reopening on a measured basis. The businesses that are failing, that have all but closed, as soon as we can, and be aggressive in doing that. And certainly the county has asked for letters, apparently, or at least a voice and opinion, and I think that we shouldn't miss that. And I think that if our state gets that same sort of note, I'm hopeful that cities just like ours who are meeting tonight will take the mantle up and encourage them in a thoughtful, prudent way to consider aggressively stepping up the plans which they have. So, Mr. Mayor, I would certainly move for letters to be sent like that, knowing full well that Adam, Bill, the staff, you can obviously craft those.
So is that a motion?
It is, sir.
Is there a second?
I'll second that.
Kathleen?
Mayor Alowis, we have a motion on the floor made by Councilmember Thompson, seconded by Councilmember Boyer. I'll call for a roll call vote. Councilmember Boyer?
Yes.
Councilmember Friedendahl?
Yes.
Councilmember Thompson?
Yes.
Mayor Pro Tem Davis?
Yes.
And Mayor Alowis.
Yes.
Motion carries 5-0.
Thank you. Moving on.